Okay, good morning, everyone. We're going to go ahead and get started as folks continue to join us. Thank you again for joining us all today for today's listening session. This is an incredible opportunity for you to share your budget requests with the New Jersey Department of Health for consideration in the upcoming FY26 state budget proposal. We appreciate all the work that you do, and we look forward to hearing your testimony. And with that, I will hand it over to Rosie.
Good morning, everyone. Thank you for joining the New Jersey Department of Health for our FY26 budget listening session. Please note that we are recording this session. We do ask that you refrain from using any AI note takers, as that is against state policy. If you have signed up to provide verbal testimony for the session, your name will be called. At that time, please unmute your microphone and provide your testimony. Until then, please stay on mute. Remarks are limited to 5 minutes. Once you reach the 5-minute mark, you will be muted. If you have not signed up to speak and you still wish to share testimony, please note that at the conclusion of registered speakers, there will be an opportunity for you to share your testimony. Thank you all for your participation today. Now we will begin. First on our testimony list is Lauren Ferrari. Lauren, if you are on, please unmute yourself. All right, we will move on. Next on our list is Matthew Hirsch. Matthew, if you are on, please unmute yourself. Matthew Hirsch. All right, next on our list is Connie Mercer. All right, thank you. Connie, we will come back and see if you or others who did not unmute are available at the end of the registered speakers. Ben Haygood with Isles. All right, thank you. Melissa Ackery with NJ211.
Good morning, and thank you for the opportunity today. Thank you, Commissioner, and the Department of Health team for this opportunity. My name is Melissa Ackery, and I'm the Chief Executive Officer of NJ211. I appreciate the opportunity to tell you about the vital services we provide and the impact we have on the health and well-being of New Jersey residents. New Jersey 211 is a nonprofit that was established in 2002 by the United Ways of New Jersey for the purpose of bringing the 211 service to our residents, and we've been doing it ever since. Our mission is to connect people in need with health and human services through a trusted 24/7 system of information and referral. We address the social determinants of health, such as housing, food security, transportation, and others that are essential for improving health outcomes. Our services, which include a 24/7 hotline and New Jersey's largest, most comprehensive human services resource directory, both have grown in demand, especially in recent years due to COVID-19, inflation, and increasing housing instability. There's been a 70% increase in our call volume and a 60% increase in website searches for help. The individuals and families we serve include some of the state's most vulnerable populations: seniors, individuals with disabilities, veterans, and ALICE families, those who are working hard but still struggle to make ends meet. In 2023, we handled over 360,000 calls and provided 738,000 referrals. This data and more is available on our website, on our public dashboard. Over the past 8 years, we have had the privilege of working in partnership with DOH to share diabetes prevention and management programs with our callers. As a result, we provide an average of 2,000 diabetes-related referrals each month. And additionally, we're collaborating with the Office of Minority and Multicultural Health to ensure that seniors in the most at-risk areas receive the health and social care resources through targeted follow-up calls and texts. As an established and trusted resource, 211 is perfectly positioned to reach the most vulnerable populations in our state. In addition to serving everyday needs, we play a critical role during times of disaster. We are embedded in the State Emergency Operations Plan for mass care, public health, and external communication. 211 is prepared today to activate the state's contact center for the Unified Victim Identification System, known as UVIS. This allows families to report missing loved ones in the wake of a mass casualty event. This is in partnership with the Office of the Chief State Medical Examiner. And during the COVID-19 pandemic, when the New Jersey Poison Control Contact Center was overwhelmed, we stepped up and within a week activated call center services to handle all non-medical COVID-19 inquiries. Over the course of the 18 months that we did this, we managed to handle over 110,000 calls and sent more than 2.5 million texts, providing vital information during one of the most challenging times in recent history. We also trained contact tracers and community healthcare workers on how to use our online resource directory. As we prepare for the upcoming FIFA World Cup events, the same level of disaster preparedness will be required. Since our inception, we have received funding and support from the Department of Human Services, Community Affairs, and Children and Families. This year, for the first time, we are coming to the Department of Health to request your support for the 211 service. We hope that you will join these other three departments in prioritizing an annual appropriation to ensure that the 211 service remains available and responsive to the needs of New Jersey residents. Therefore, we are requesting $200,000 in the fiscal 26 budget. This will support the infrastructure, ensuring our team remains well equipped to serve the Department of Health. And by investing in NJ211, we can collectively contribute to the health, well-being, and resilience of our New Jersey residents. Thank you so much for your time and your consideration. I look forward to your partnership in continuing to make sure that every resident has access to the help they need when they need it most.
Thank you for your testimony, Melissa. We'll now call on Carl Moran.
Thanks very much. Carl Mirren, I'm the HDSA Advocacy Chair talking about the funding in the grant for the HD Clinic. And we're very grateful to be having this conversation early in the budget process when a real problem can be addressed. And I'm going to talk about that problem briefly before turning this over to Dr. Michael McCormick, Director of the clinic. Problem number one is that the reduction in the grant since 2014 has resulted in substantial cuts in the care that New Jersey families receive. Second part is that private or government health insurance will not and cannot make up the difference. On top of that, there's so many unique aspects to HD as a disease and how it progresses. Among those, the large percentage of HD patients who are going to stress the nursing home system in New Jersey, and the long span, 20 years on average, that people are symptomatic. And thanks for that time and turning this over to Dr. Michael McCormick.
Hi, good morning, everyone. It's Dr. Michael McCormick. I'm professor of psychiatry at Rutgers Robert Wood Johnson Medical School and professor of cell biology and neurosciences at Rowan Virtua School of Medicine in South Jersey. I began the Huntington's program about 45 years ago here in New Jersey, caring for literally thousands of families who have been afflicted with Huntington's disease. For those of you who don't know, Huntington's disease is an inherited condition. It's inherited as an autosomal dominant gene, which means that if you have an affected parent, your chance of inheriting this gene from your parent is 50%. It is a neuropsychiatric disease in that it impacts several vital functional roles in an individual, including their memory, or we see dementia in patients, psychiatric disturbances, we see sometimes psychosis, or a bipolar type neurotic disease. And finally, we see movements, that is chorea type movements in patients with Huntington's disease. So that's the triad of symptoms. It is a progressive disorder, and what's happening in the brain of patients who have Huntington's disease is that part of their brain is deteriorating with cellular death as a consequence of having an abnormal protein in the brain called Huntingtin. In patients with Huntington's disease, it is a long-term disease that often is characterized by a more than 20-year progression from early symptoms and then spending the last 5 to 7 years of their life in long-term care, requiring a multidisciplinary team to care for the various aspects of the disease. We have been supported by the Department of Health for almost all of those 40 years, and those funds have sort of remained for the last several years at sort of a constant level, and are significantly lower than our funding had been more than 10 years ago. As a consequence, we have appealed to the legislature and to the Department of Health to reevaluate our need for funding. We have had to reduce our staff, eliminate a full-time social work case manager in our program, and are barely holding on to the 0.3 FTE social worker that we have working in our program today. Likewise, we reduced our nursing case manager time element as well, so that the number of patients that we can see and the frequency with which we can see patients has been decreased over time. In our clinical program, we provide neurological services, psychiatric services, genetic services, social work, case management, therapy, both family and individual and couples therapy, nursing case management, which includes medication management, as well as home visitation for safety evaluations of home for patients who remain with their loved ones at home. Our goal is often to provide maintenance of function for patients and to enable them to stay in their home for as long as possible, precluding the need for more expensive long-term care in a state licensed facility for Huntington's disease. We have 2 specialized service units in New Jersey, which we developed in collaboration with some nursing home programs, which provide services to about 100 residents with Huntington's disease. This condition has an incidence of about 1 in 10,000, which means in New Jersey, with a population approximately of 10 million people, we see about 1,000 patients with Huntington's disease. Now, some of these patients in the early stage of disease can function quite well at home. They continue to work and to carry on normal functions in their family. But as the disease progresses, they lose the ability to work. They fail to be able to continue their role as income earner for the family, and it produces a severe burden on the part of the caretaker, who will take care of the afflicted patient or spouse, as well as often minor children in the household as well. As a hereditary disease, we know that we continue to see generations of young people who will be afflicted by Huntington's disease, so that we know that the population with Huntington's disease will remain an issue here in New Jersey, as it does in any state. We are one of the 62 recognized.
We're at
Pardon
5 minutes. We're at
Okay,
your 5
sorry.
minutes.
Well, just one more issue is that we are a nationally recognized Center of Excellence for Huntington's disease.
Thank you very much for your testimony. We do need to stick to the 5-minute limit. So I'm going to go ahead and move on to Kathy Chin.
I'm here. Hello. Can you hear me? Can you hear me?
We can, thank you.
Okay, terrific. Good day, Commissioner Baston and members of the Department of Health. My name is Kathy Chin, and on behalf of ABCD, thank you for this opportunity to present, to share our thoughts as you begin deliberations on the FY26 budget. It means a lot to us to be a part of your process. Thank you for the 3 recent increases in the early intervention rate. They are an important first step, but they alone will not solve a problem over 15 years in the making. undervaluing and underpricing early intervention over the last few decades has eroded our prestige and talent. Specifically, it has resulted in a workforce which continues to choose to work in hospitals, nursing homes, and schools, which, unlike early intervention, has been able to keep pace with wage growth. Resulted in untold numbers of infants and toddlers with developmental delays or disabilities who have missed a narrow window of opportunity to minimize and prevent barriers to their development, undermining their capacity to realize their full potential. Resulted in services that have been unavailable to numerous eligible minority, low-income, rural, urban, and foster care children, and prevented a 300 to 800% combined rate of return from avoided costs in the early or formidable public cost of K through 12 education, Medicaid and Medicare, and from increased income taxes of adults who benefited from early intervention as children. If we wish to go forward, stasis is not a solution. The state must commit at least as much time to building early intervention back up as it did to wearing it down. Please consider providing an annualized cost of living increase of 2.5% for early intervention providers. And thank you very much for this opportunity.
Thank you for your testimony. We will move on to Dr. Stephen Labuti.
Thank you all for the opportunity. I'm Steve Labuti, the director of the Rutgers Cancer Institute, an NCI designated comprehensive cancer center, the only one here in New Jersey. And I'm here this morning to talk about a joint program managed by the Cancer Institute and the Department of Health of the state called Screen NJ. Screen NJ is a cancer screening program where we screen New Jersey residents for high incident cancers with the mindset towards early detection and in some cases elimination of cancer progression. Screen NJ was launched as a joint program in fiscal year 18, and this current year our budget was cut by 25%. And so I'll start at the beginning by saying our request is that our budget be restored to the full $4 million of support that we received from the state to do this important work. Screen NJ is in approximately 522 partner sites across the state in all 21 counties. Since its inception in fiscal year 2018, we have screened over 98,000 New Jerseyans for cancer. We've detected almost 8,000 early lesions that could be treated at the time of screening. There are 53,000 new cancer cases in the state of New Jersey each year, and Jersey ranks 6th in cancer incidence in the United States. We've also conducted education programs for close to 200,000 New Jerseyans, tobacco cessation for close to 50,000 New Jerseyans, and this work has an important financial impact. If you estimate that the cost of a cancer diagnosis is approximately $100,000 per patient, the 7,700 cancers that we detected early and could eliminate at the time of screening saved almost $1 billion. And so that $4 million investment has a tremendous return on investment, not only in dollars, but in lives saved and patients' lives improved. The result of that 25% cut has forced us to lay off navigators that help to navigate patients to screening, to eliminate educational resources that we have, and we project that we will lose the ability to screen roughly 40,000 New Jerseyans as a result of the cut. So essentially our request, as I said at the beginning, was to just restore the investment made by the state government of $4 million for this jointly managed program, as its impact is very clear on the health benefits and financial toxicity of this disease in our state. So I thank you for the opportunity to present this information.
Thank you. We will move on to Patricia Carlesimo.
Hello, good morning. Can you hear me?
Thank you.
Can you hear me? Yes?
Yes, we can.
Oh, good. Okay. My name is Patricia Carlesimo, and I am the Executive Director of Lattice Network and the Vice President of ABCD. You just heard Kathy Tin, our Executive Director, speak. our provider association that represents well over 10,000 individuals with significant and complex medical and behavioral needs and/or behavioral needs. Lattice Network, formerly Cerebral Palsy of Monmouth and Ocean Counties, was a founding member of ABCD and has been operating for 75 years. We serve 35 individuals across Monmouth and their families across Monmouth and Ocean Counties through a lifetime of services, including child care, early intervention, DOE-approved schools, adult day services, residential and respite services. ABCD also has an early intervention provider association, ABCD-EIPA, that supports 15 provider agencies that serve over 60% of the children in EI across the state. Lattice itself provides extensive early intervention services with over 125 therapists and teachers providing ongoing services to 1,000 plus families and evaluations for eligibility for 125 children per month in Monmouth County. Many of our EIPA members have been providing EI for 20 to 30 years. They are dedicated to the families and children and to the success of the system. Sustaining exemplary services is our core mission as a group. We continue to have significant workforce shortages and compete with hospitals, nursing homes, school districts, and others for a very small elite group of licensed therapists and teachers in the state. Thank you for the past 3 rate increases. They had a very positive impact on our ability to retain staff. And I'm just reviewing stats from the last year. We actually increased our hiring in physical, occupational, and speech therapy as a result. Finally, we were able to recognize our current staff, giving them critical salary increases. But costs continue to rise for everyone in every business. We need to remain competitive to attract professional staff to the field and retain the incredible staff we have. We respectfully request consideration of a COLA increase of 2.5% for fiscal year 2026. When you consider the increases in 21-22 were the first in 16 years, they're still significantly underfunded, which ultimately impacts hiring and retention and therefore the infrastructure of the entire system. In summary, I know I speak on behalf of the families served by Lattice and those served by our ABCD members in thanking the governor and the department for their commitment to early intervention. We're proud to be partnering with our state leaders in ensuring that our families have what they need to give their child the best opportunity to reach their potential. This department has been responsive and open to stakeholder input, which is an immeasurable benefit for all of us. Collectively, we know that early intervention works and ultimately saves state dollars by providing supports to families so that their babies can reach developmental milestones, thereby reducing the need for lifetime services. Thank you very much for this opportunity. Thank you to the Commissioner and to the department. Thank you.
Thank you for your testimony. We will move on to Adara Heilman. Adara, could you please unmute yourself to provide your testimony?
I apologize for that. Thank you so much. Good morning, Commissioner Baston and the Department of Health staff. On the behalf of the ARC of New Jersey, I want to extend my gratitude for the opportunity to present our testimony as a recommendation for the Department of Health's fiscal year 2026 budget. As the largest advocacy organization in the state for individuals with intellectual and developmental disabilities and their families, we are dedicated to supporting these communities across all 21 counties, including those served by our local chapters that provide early intervention services. We commend the Department of Health for its continuous efforts to enhance the lives of New Jersey residents, particularly those with IDD and their families. Among the many important programs overseen by this department, the New Jersey Early Intervention System is indispensable to this population. Early intervention services assist children with IDD in meeting their essential milestones in language, gross and fine motor skills, cognition, behavior, and social emotional development. Additionally, EI provides invaluable support for families through their social work services and parent coaching, ensuring that the benefits of these services extend far beyond the age of 3. We sincerely appreciate the governor and the legislature for funding the appropriated in the fiscal year 24 budget to increase early intervention rates. This increase was a clear acknowledgement of the significance of those services for infants and toddlers. However, we must highlight that the ongoing need for additional funding as the New Jersey early intervention system faces a high access to timely services list compounded by an increase in referrals. In the realm of early intervention, families cannot afford to wait for services. Many practitioners are leaving the field for better and more consistent compensation elsewhere. Provider agencies are struggling to attract and retain new talent without being able to offer more appealing incentives offered by the school districts and the local hospitals. It is vital that we make early intervention an attractive career path for these candidates. To address these pressing issues, we must raise rates to attract more practitioners and incentivize them to enter this vital field. It is essential that early intervention be made as appealing to providers as settings such as hospitals and schools, which often encounter fewer challenges in retaining qualified professionals. That is why we stand with ABCD in urging the department to increase early intervention rates by 2.5% in the fiscal year 26 budget. This request aligns with the 2.5% inflation rate measured by the Consumer Price Index over the past year and would require an investment of approximately $4 million. This funding is crucial to ensuring the infants and toddlers with developmental delays have access to skilled practitioners and essential therapies. Finally, I want to comment on the rate study commissioned by the Department of Health 3 years ago. At the most recent SICC meeting, Senator Ruiz's staff informed the SICC membership that they had learned that the rate study had never been completed by PCG and the state was seeking a new vendor to carry out this work. This is very disappointing and upsetting news as our providers invested considerable time, effort, and resources into participating in the study. Furthermore, in previous conversations with representatives from the department, we were told that the study was complete. We are further disheartened by the lack of transparency surrounding the rate study and its findings. The early intervention system continues to struggle mightily with onboarding and maintaining practitioners due to rates. It was our hope that the rate study would be a critical key in our advocacy efforts, and that it would allow us to illustrate the gaps that needed addressing and help us in our work to create a more stable and robust early intervention system. It should be noted that the last rate study was performed in 2002, 22 years ago, which is a true disservice to the infants and toddlers with developmental disabilities who rely on early intervention services. We would urge the department to clearly communicate about the current status of the rate study and to develop a comprehensive plan for how it will address the rates. Thank you so much for the ability to comment today.
Thank you for your testimony. Now we'll call on Michael Bascom.
There we go.
Michael Bascom, would you like to provide your testimony?
Sure, just having a little trouble unmuting. I think I'm okay now. Thank you, Commissioner Basson and team for taking time to listen, and thank you for your previous support of our program and EMS in general. My name is Michael Bascom. I'm the president and state leader of the New Jersey Emergency Medical Services Task Force. We are the primary EMS planning and operational entity to support the New Jersey Department of Health, the State Office of Emergency Management, and the state healthcare coalitions. We were born out of the attacks on September 11th through federal funding and ultimately codified into New Jersey law in 2017. We're a vital resource that is currently operating with equipment that is at or beyond the end of its lifespan and at risk of failing. Without immediate support, the state of New Jersey will begin to experience a degradation in our capacity to plan for and respond to public emergencies. This is obviously terrible timing for a state that remains critically dependent upon services like ours when threats to public health and public safety remain so high, and as we prepare for hosting the World Cup and work to address the deficiencies identified in the COVID report. We're requesting the state provide us with a one-time allotment of $20 million from American Rescue Plan funds to replace and acquire equipment that is critical to our survival and critical to maintaining and improving the state's capacity to respond to large-scale emergencies. In addition to this one-time emergent capital need, our task force needs a sustainable source of state funding. To ensure our continued existence, we project a need of $2.5 million per year. This funding will ensure that we have the necessary staffing in place and that our volunteer and career members have appropriate personal protective gear, proper insurance coverage, training, equipment, and supplies necessary to support our joint mission. Our organization has developed a specialized capability that supports all aspects of healthcare and public safety. Our equipment and manpower are utilized daily throughout the state to respond to local and regional emergency incidents, which most recently include wildfires, cyber attacks on healthcare facilities, healthcare facility evacuations, and special event coverage. Throughout our 20-plus years of service to the state, New Jersey EMS Task Force has been recognized as a model for similar agencies throughout the country. For instance, the state of New York recently authorized $50 million over the next 2 years to fund the development of a New York EMS task force as part of a broader package to address the EMS crisis. Unfortunately, the funding structure for the New Jersey EMS task force is inadequate and uncertain, making it challenging to sustain these vital operations and plan for the future. The primary funding for the task force over the years has come from federal funding subgranted to us by the state to support our response to catastrophic events. We were funded after September 11th, again after Superstorm Sandy, and again during COVID. This is not a sustainable model for capital improvements. In between, we have been the recipients of federal preparedness funding and occasional state budget allotments provided through the Department of Health. However, this funding is not sufficient to cover our overall operation and is always at risk. During the COVID pandemic, at the request of the state, we were called upon to evacuate healthcare facilities, to create and operate mega sites for vaccination and testing. We developed and staffed local vaccination sites. We handled delivery of more than 840,000 doses of vaccine. We boosted the capacity of hospitals through the provision of equipment and temporary hospital structures. We secured and distributed personal protective gear for emergency workers, worked closely with our state and county partners to attack the crisis, and managed the National Ambulance Contract, which provided assistance to EMS agencies who were dealing with staggering call volumes and staff shortages. The New Jersey EMS Task Force will not be able to provide this type of support in the future without your support today. Thank you for your support and your attention to this matter.
Thank you for your testimony. We'll now call upon Chris Merkel.
Good morning. On March 23rd, 2020, I got up and got dressed as I normally would for work and went through my normal routine, made coffee, ate breakfast, and got ready to leave. As we all know, it wasn't just another normal day. Governor Murphy issued the statewide stay-at-home order on Saturday, March 21st, which closed all non-essential retail businesses. My daughter chased after me as I was walking out the door. "Dad, where are you going? What is happening?" I assured her everything would be okay and I had to go to work. As she told me she was scared and she couldn't go to school anymore, I could see the terrified look on her face as I hugged her one last time and told her I would speak with her tonight about it as I got my county vehicle and drove away, trembling at the fact that I had to leave my daughter in such a distraught state. I, in fact, didn't know what was going to happen, and I didn't know everything was going to be okay. Not being able to console my daughter and stay with her on that fateful day is one of the biggest regrets of my entire life. My name is Chris Merkel, and I am the current president of the New Jersey Association of County and City Health Officials. I am also a county health officer, a father, a husband, a neighbor, a community member, and an advocate and a person who cares about other people. There are many stories like mine, courageous stories of public health professionals putting their life and sanity on the line to combat a new and fairly unknown novel coronavirus that was starting to spread rapidly through New Jersey and the country. Early on, local health departments fought this enemy with limited resources and funding. Federal grant funding came later, after the initial surge of clinics had slowed down. Fast forward to today, federal COVID grant funding is drying up and local public health budgets are strapped. Some local jurisdictions will not commit to keeping public health staff used with federal grant funds. Once those funds dry up, staff will be gone. A recent 2023 Harvard study found that between 2017 and 2021, nearly half of all employees in state and local public health agencies left their place of employment. If separation trends continue, by 2025, which is about 2 months away, more than 100,000 local public health staff will have left their organizations. This at a time where 80,000 more full-time public health employees are needed just to cover the basic foundational public health services, according to another study. Local health departments in New Jersey are feeling the pinch, overworked and understaffed, most still reeling mentally from the COVID pandemic. And Jacho has been working hard over the last few years, speaking with elected officials and representatives from the New Jersey Department of Health to convince them of the need for sustainable and flexible funding in the state budget. Current legislation, which unfortunately has not moved through the legislature, would guarantee $10 million annually for public health priority funding to be distributed to local health departments. $10 million is certainly not enough, but it is a start. I'd like to thank Commissioner Baston for her support of local public health and for understanding the need for the local public health system in New Jersey to be properly funded long term. The association is requesting $10 million to be inserted into the FY 2026 state health budget to help support struggling health departments who are facing with laying off employees who faithfully serve our residents of this state. As New Jerseyans, as New Jersey's independent review of New Jersey's response to the COVID-19 pandemic states in its final report, an overarching theme that emerged in many different contexts was that public health system requires ongoing investment. It cannot be ignored or underfunded for years and then be expected to become capable of handling a massive global crisis. An effective public health capability requires sustainable and consistent financial support, including adequate staffing and compensation that attracts people with the necessary knowledge and skills to perform the vital tasks required of the NJDOH and local health departments. Together, we can ensure that local public health is ready to combat future health emergencies, which undoubtedly will come. Please support $10 million in the FY 2026 budget for local public health direct funding. My daughter's generation depends on a robust public health system to support and watch over them, whether they realize it or not. Thank you for your time.
Thank you for your testimony. We'll move on to Linda Brown.
Hi, good morning. My name is Linda Brown, and I'm the Executive Director for the New Jersey Association of County and City Health Officials. I want to thank you for the opportunity to speak today. As you just heard from my colleague, Chris Merkel, we are representing the local health departments. So have you ever heard that saying, health is wealth? It sounds so simple, yet practically speaking, we often don't appreciate the deep truth in those words until you realize you don't have what you need to be healthy or you're facing a health crisis. For a very long time, achieving good health has been seen simply as a personal responsibility. However, we know this is unfair and oversimplifies the very complex interactions that impact our health each and every day. Health is profoundly impacted by the air we breathe, the water we drink, the food we eat, but also the access to resources in our communities. So who protects these things? Our local public health professionals do. Today, I'm representing the thousands of highly skilled, educated, passionate, and incredibly undervalued workforce for the 104 local health departments serving the state of New Jersey. I implore you to prioritize an investment for local public health as they're an invaluable asset to our communities. These amazing public health professionals are doing the impossible day after day. They protect communities by providing services, oversight, education, and they're often in the background. So what does your local health department do? I certainly don't have time to list them all, but I figured I'd give you a few you might relate to. So I got my flu shot 3 weeks ago, thanks to my local health department. Do you have a dog or a cat that needs a rabies vaccination? Check with your local health department. Have you enjoyed a meal lately at a restaurant? If the food workers wash their hands, store the food at the correct temperature, and best of all, you didn't get sick when you got home, thank your local health department. A preschool classroom of 22 3-year-olds chose to close temporarily, thanks to the advice of their local health department, as a way to protect the children and their staff when an outbreak sickened many. Have you attended a festival or community gathering? Perhaps enjoyed a meal or snack from a food truck? Thank your local health department for providing inspection and ensuring safeguards like hand washing stations were available. A family just arrived from New Jersey without health insurance, attempting to enroll their children in public school to learn that they needed vaccination. The local FQHC could not see them until 2025. Their kids are now in school thanks to the vaccinations provided by your local health department. The residents who rely on septic systems to remove waste from their homes, wells to provide water for their homes, all inspected by your local health department. There's an unknown odor alarming residents, renters concerned about environmental concerns like mold or lead, Concerned with a family member residing in a long-term care facility, who are they calling? The local health department. Our New Jersey local health departments pride themselves on always answering the call. They build bridges and trust with our communities. They're allowing access to essential services, education, and resources, filling gaps that others can't. We thank the New Jersey Department of Health for providing financial support for local health agencies through grants. While these are appreciated and absolutely necessary, they are just not enough. These financial investments have varied by topic or health issue, and the current crisis funding funding or other priority areas set by the state or federal levels. The heavy restrictions are hugely limiting to the true and ever-changing needs of these local communities. Grants have helped to build capacity, but funding cuts and end dates are always looming. You heard my colleague, Mr. Merkel, refer to the crisis funding and how devastating this is going to be to our workforce. Local community tax dollars have continued to fund nearly all essential operations of local health departments. Tax caps and other local priorities pose a challenge for all communities in New Jersey, but the cuts that are felt by local health agencies are often deeper and more severe. It's time for the New Jersey Health Department budget to reflect a commitment to our local communities with a significant investment in our local health departments. According to the Trust for America's Health report, New Jersey ranks 31st in this country for state funding for public health. New Jersey is better than this. Our communities deserve better than this. Our residents deserve more. Local health departments work every day to understand their communities, serve their needs, and protect them from an immeasurable number of risks. They need your help more than ever. It's time that we see a sustainable, flexible funding stream in the state budget. Thank you for your consideration.
Thank you for your testimony. I'll now call upon Megan Shepherd. Megan Shepherd, would you like to provide testimony at this time? All right, we will move on to Lynette Medeiros.
Okay. Please help me. Am I going to die? I don't want to die alone. Am I going to give this to my children? My mother is in the hospital. I can't see her, and they don't think she's going to make it. I want to see her one last time. These were just some of the sentiments I heard from my residents during the pandemic. Their voices and stories still haunt and play repeatedly in my head. Good morning. My name is Lynette Medeiros. I'm the Advocacy Chair for the New Jersey Association of City and County Health Officials and the past president of the New Jersey Environmental Health Association. We represent public health employees throughout the state of New Jersey. Some of my colleagues and I worked 18+ hours a day. It was a work shift with no end and no one to relieve us at the end of the day. At points during the pandemic, we went from heroes to villains. I've worked in local public health in New Jersey for over 20 years, proudly serving in Hudson County and now Passaic County. I've weathered many storms in my tenure, both literally and figuratively. From H1N1, Superstorm Sandy, water main breaks, foodborne outbreaks, monkeypox, Ebola, and most recently, COVID-19. Many of us in public health refer to ourselves as the invisible workforce. We don't get parades, banners, and TV shows. Our budgets are usually the first cut and the last to get funded. Many of us function in different roles under one title because we do not have the staff. Our public health workforce is tired, suffering from burnout, PTSD, and is losing appeal to new and upcoming talent in lieu of more lucrative private industry and nonprofit jobs. In 2011, our state funding, known as public health priority funding, was eliminated. We are one of the only states in the nation that does not receive state funding for public health, yet we are one of the most vulnerable states in the nation. Our sole funding source is local taxpayer dollars, crisis funding, and non-flexible prescriptive temporary grants. These temporary funding sources from grants or crisis funding do not allow health departments to thrive and build a robust and sustainable foundation. When that funding goes away, so do the vital services to our residents. We are forced to pick and choose, and we are constantly asked to do more with less. The public health workforce was already in dire straits prior to the pandemic, but COVID exposed the overwhelming need for funding and support. None of us went into this field to make a lot of money. We went into this because of a passion for helping people and the belief that we can make a difference. I like to picture the public health system as if it were a game of Jenga. Each block represents a vital piece of the public health system, including a block that represents the New Jersey Department of Health. Together, they create a more robust and durable foundation. However, as each block is removed, it creates a progressively more unstable structure and eventually a collapse. Long-term sustainable funding will help foster a solid and thriving public health system in New Jersey. The way we were there for the residents of this state, we are asking for your support funding a minimum annual state appropriation of $10 million for public health priority funding. $10 million is just a start. As I'm sure you are aware, we have a saying in public health. It's not if, but when. We can't predict when the next crisis will be around the corner. Public health is the cornerstone of a thriving community. It protects not just individual health, but the health of our entire population. Over the past few years, we have witnessed firsthand the critical role that a robust public health infrastructure plays, especially during crises like the COVID-19 pandemic. However, as we continue to navigate the aftermath of such challenges, it is clear that our local health systems are under-resourced and in urgent need of support. Funding will allow us to expand preventative services such as immunizations, screenings, and health education programs. Investing in prevention can reduce the long-term costs of healthcare and improve the quality of life of our residents. Health departments are on the front lines of emergency response. Additional resources will enable us to better prepare for future public health crises, ensuring our community is resilient and ready to respond effectively. Significant disparities in health outcomes exist based on socioeconomic status, race, and geography. With increased sustainable funding, we can implement targeted programs to address these inequities and ensure all community members receive the care that they deserve. Our public health workforce is critical to the success of our initiatives. Increased funding would allow more training and recruitment, enabling us to attract and retain skilled professionals dedicated to improving community health. In conclusion, the investment in public health is an investment in our community's future. I implore you to help us rebuild health departments in New Jersey. We must ensure that we can respond effectively to health challenges, promote wellness, and build a healthier, more equitable New Jersey. I urge you to consider the profound impact that increased funding can have on our lives of our residents. Please be a part of the construction and not the collapse. I thank you for your time and consideration, and thank you for all the New Jersey Department of Health does for New Jersey.
Thank you for your testimony. We'll now call on Paul Roman.
Good morning. I'm a volunteer with over 55 years as an EMS provider and educator, 47 years in local public health, and served 27 years as president of the largest and oldest New Jersey 6 regional health commissions. Today, I speak as president of the New Jersey Local Boards of Health Association, with the de facto voice of New Jersey's over 450 local boards of health. Comprised of more than 3,200 elected or appointed local board members, we are the governance component supporting New Jersey's health departments in our unique home rule system. I also serve as the vice president of FACE, the Public Health Association's collaborative effort, which represents the 6 state Department of Health recognized public health organizations, a couple of which you've just heard from. I am also the current chair of the New Jersey Public Health Council, your advisors on matters of public health. Excuse me. New Jersey's boards of health and health departments are 50th, depending on what study you read, in the nation on funding from state sources. So I beg the question that Linda Ronstadt has asked, when will I be loved? Public health priority funds given to local boards and health departments statutorily for over 34 years was in trouble. In 2011, the Grim Reaper struck. The allocation resulted in loss of staff, loss of programs, and consequently a loss of education, engagement, and enforcement. Compared to national standards, New Jersey's health departments are underfunded 3-to-1. We must reverse this trend. At least every dollar lost from public health priority funds has been painfully made up through the local property tax base, which is subject to the cap law and doesn't cut it. All of the grants provided in support of COVID activities have either expired or will expire this next July. There is no money for foundational services and routine operational costs for our health departments. This will again result in the same condition we found ourselves prior to COVID, where we lost personnel and programs and found it difficult to maintain New Jersey's mandated minimum standards. Additionally, under the auspices of the Public Health Council, who, while advisory, still has the authority to recommend that the State Department of Health budget contain a plan whereby the budget will include a special projects and development fund. This would fulfill the need to meet the standards of performance and should be considered priority health services and be provided in the form of grants to the local and county departments and regional health commissions. In our annual budget address to each house of the legislature, we annually offer 6 dedicated revenue streams, which we offer to you for your consideration for possible inclusion in the Department of Health budget and other related areas of the state budget to offset increased local health department funding, such as providing a sales or excise tax on vaping products. This may help to cut the use. Add an additional 10 to 15 cents to the tax on cigarettes and tobacco products. Increase the proposed assessment on health insurance companies. Increase the opioid assessment fees. Place a surcharge on certain health-related licensing fees and include a small increase in the proposed state revenue from sale of recreational marijuana. The current FY25 Department of Health budget totals $1.33 billion. This is a $90 million or 6.3% decrease from last year. The department objectives outlined in the budget include, quote, strengthen local public health infrastructure, unquote, but provides almost no specifically dedicated funds for this purpose, roughly 2%. There is federal funding for this purpose distributed through the state. However, this is declining due to pandemic funds drying up and inflation. Bipartisan bills were introduced in the legislative session to restore public health priority funds and set a minimum of $10 million. For the second time, the Senate's Health Committee approved the bill S 2010. But the Assembly Health Committee has so far failed to discuss this bill A 1854. Some feel that $10 million is too much money. However, if the formula already in the existing legislation were applied, some departments would receive less than $50,000. Even to a small department, this money will not go very far. With your support, we need to let the governor know that when PHPF bills S 2010 and A 1854 finally reach his desk, that he should sign this bill for $10 million, which would become a restored annual appropriation, including planned future COLA increases. At present, New Jersey is participating in a large national study to determine the true cost of foundational services. The results of this study would be translated into a true future picture of New Jersey's basic needs and which would drive future PHPF awards. 2 final comments. First, we all support the creation of the New Jersey Public Health Institute. However, the bill introduced to grant state recognition needs to be amended in accordance with the white paper drafted by the members of FACE. Second, we are pleased to see some legislation which will support some of the 33 recommendations in the report of the state responding to the COVID pandemic. Thank you for your work in that area. Finally, in recognition of National Public Health Week, Governor Murphy showed his commitment to public health by issuing a proclamation in which he stated that, quote, strategic investments in prevention could result in significant savings in health care costs. By adequately supporting health and prevention, we can continue to transform a health system focused on treating illness to one focused on prevention.
Comments.
We in public health need action and adequately permanent funds to bring his vision and yours to life. Thank you.
Thank you for your testimony. We will now move on to Mary Abrams.
Good morning, still morning, couple minutes to morning. I'm Mary Abrams, Senior Health Policy Analyst at the New Jersey Association of Mental Health and Addiction Agencies. Thank you for this opportunity to provide input on the fiscal year 2026 budget. The New Jersey Association of Mental Health and Addiction Agencies, known as NJAMA, represents 164 hospitals and other organizations that serve 500,000 unduplicated children, youth, and adults each year. NJAMA's fiscal year 2026 campaign, Untold Stories, which will be published in the coming months, will illustrate not only the powerful positive effects of behavioral health services have on individual lives, but the unacceptable levels of unmet need. As you identify budget priorities, please keep in mind the startling mental illness and substance use prevalence levels that continue to be reported for children, youth, and adults, and the behavioral healthcare infrastructure and workforce that are needed to support them. As the demand for services continues to grow, additional investment is needed along the behavioral health continuum of care. This is especially true for inpatient psychiatric units that are under the direct purview of the Department of Health. NJAMA recommends increased funding for additional inpatient beds, particularly for children and youth, and specifically for children and youth with intellectual and developmental disabilities. The department also has full responsibility for licensing behavioral health facilities. The delay in issuing these licenses is a long-standing issue that significantly affects access to care. While there are multiple contributing factors to the delays, NJAMA believes that additional staff and the licensing unit is needed and fully supports funding for this. We also recommend increased funding for the Quality Improvement Program, QIP, with the intended purpose of providing financial incentives for community-based behavioral health care providers to develop partnerships with the participating hospitals. Such incentives would increase the involvement of community-based providers, maximizing the potential for successful outcomes in QIP. NJAMA also supports sustaining or expanding other programs in the fiscal year 26 budget that have significant impacts on individuals with a mental illness and/or substance use disorder. We recommend that the department sustain the Graduate Medical Education GME funding at $242 million, which includes $34 million for the supplemental GME, and that they maintain the fiscal year 2025 total of $793.1 million in direct subsidies to hospitals through the combination of the new Medicaid outpatient supplemental state-directed payments and charity care distribution. We wish to thank the department for its continued support for the expansion of harm reduction centers throughout the state. The services individuals receive at these centers save lives and are a pathway to treatment and recovery for many. In closing, I do want to share that NJAMA and its members are eagerly looking forward to the possibilities and the benefits that the integrated license will bring to the provider network and all those who they serve. We thank the department for the immense and thoughtful effort put into this initiative. Thank you.
Thank you for your testimony. We will now call on Janice Bakel. Janice, are you present and able to give your testimony at this time? All right, we will move on to Kathy Rowe. Kathy Rowe, are you present and able to give your testimony? All right, we will move on to Megan Glazer.
Good afternoon. My name is Megan Glazer, and I'm the Vice President of Leading Age New Jersey and Delaware. Thank you so much for the opportunity to speak with you today on behalf of our association, which represents over 150 primarily nonprofit, mission-driven aging services providers. We represent the full continuum of care, so nursing homes, assisted living residences, and home and community-based services like PACE, hospice, and assisted living programs, as well as independent senior affordable housing communities, so HUD 202 properties mainly. In the interest of time, I'll keep my remarks brief as I plan to circulate a more detailed written statement. Our members continue to work extremely hard caring for older adults while dealing with the ever-changing regulations and severe staffing shortages. Many of the organizations, which I'm really proud to represent, have made it their mission for more than 100 years to take care of the frail and elderly in our state. I want to make sure that one day, if I should need that care or a loved one, that these organizations still exist in New Jersey. The number one priority of our members is making sure that they have the staff and resources to provide quality care for older adults. While we greatly appreciate the support that both the legislature and the administration has provided to our sector the last few years, the truth is, as you've heard many others say, is that reimbursement rates have not kept up with the cost of providing services, and our association has serious concerns about the future of long-term care in New Jersey. LANJDE is appreciative that last year's state budget increased funding for nursing homes, and we're grateful that the state is in the process of implementing a cost report-based rate setting system. Leading Age New Jersey Delaware strongly supports reimbursement that fairly compensates providers for the costs they submit and guarantees quality care for nursing home residents. With that said, from cost reports submitted to the state, we anticipate a shortfall of $60 to $80 a day. The state fiscal year 2025 budget maintained the much needed tiered rate increase for assisted living residences, assisted living programs, and comprehensive personal care homes for facilities and programs whose population had a minimum of 15% Medicaid members. However, it failed to provide across the board rate increases for all assisted living providers. This year, in support of our assisted living members, which all help save the state of New Jersey money by keeping people out of higher cost of care settings like nursing homes, we ask that the state budget include further increases to the Medicaid reimbursement rate, which will help older adults age in place. Leading Age New Jersey Delaware also respectfully requests the state to consider an increase to the asset limit for Medicaid to align with the asset limits for the threshold for the JAC program to $40,000. The current asset limits for state plan benefits force low-income older adults and people with disabilities into deep poverty, and it disproportionately harms people of color. With minimal fiscal implications for the state, this change will create parity and reduce coverage gaps across state programs, enabling increased access to critical services that support older adults. Last but not least, across the continuum of care, Leading Age New Jersey Delaware members continue to face extreme challenges due to the workforce crisis. Therefore, any investment in workforce development targeted specifically at long-term care would be greatly appreciated and is of the highest priority to our members. In conclusion, I just want to reiterate that these continue to be very serious times for aging services providers, their staff, and those they care for in New Jersey. Increased funding is critical now more than ever. Thank you again for your time today, and we look forward to working with the department as the budget process progresses.
Thank you for your testimony. We will now call on Debbie White.
Thank you, Commissioner and committee members. My name is Debbie White. I'm the president of Health Professionals and Allied Employees. We are the state's largest union of healthcare workers. We represent 15,000 nurses and other healthcare professions in both public and private sectors. I'm also a long-term hospital RN of nearly 40 years. Our primary focus this year is to gain passage of S2700A 3683, which is the Patient Protection and Safe Staffing Act, the Safe Staffing Bill that will create nurse-patient ratios in New Jersey's hospitals. Our budget requests, therefore, are centered both around safe staffing and public health, including our only public state-owned hospital in New Jersey University Hospital. The overwhelming data from the research done around nurse-to-patient ratios clearly shows that this is not only the best solution for nurse retention, but for patients as well. Why? Because when there are limits on the number of patients a nurse can care for at any given time, patient outcomes improve. To be specific, patient deaths decrease. There are less bed sores, less hospital-acquired infections, less violence incidents, less falls, even increase patient satisfaction scores. And because of all this, the reimbursement for hospitals increases. So hospitals benefit from safe staffing. It's all there in the research. We also see a mass migration of nurses out of our hospitals due to unsafe staffing. So this legislation will go very far in helping to retain the nurse workforce we gain every year, and the same workforce that continues to migrate out of our hospitals. The Department of Health will be the line of enforcement of the new safe staffing bill. So we include a way to increase the department's revenue stream in our submitted testimony, but we are also advocating for an increased budget funding for the department because we'll need more staff to provide inspections and enforcement. While waiting for the passage of legislation, we made significant gains through bargaining enforceable safe staffing ratios in 5 of our most recent contracts, and we are going to continue to do so this year. University Hospital was one of those contracts. So we are asking the commissioner and the department to advocate on behalf of University Hospital for increased funding in its line item budget from the governor in this coming fiscal year. For University Hospital, we're also requesting that charity care funding be increased by 10 million and GME funding be increased by 2 million for this year. Thank you so much for listening to our request.
Thank you for your testimony. We will now call on Andy Zinmeister. Andy Zinmeister, are you available to provide testimony? All right, we will move on to Haki Cumberlander. Haki Cumberlander, are you available? All right, we will move on to Caitlin Woidowitz.
Thank you very much, Commissioner Baston and the entire Department of Health staff. My name is Caitlin Woidowitz. I serve as the Senior Vice President of Public Affairs at Planned Parenthood Action Fund of New Jersey, and we advocate on behalf of the 2 Planned Parenthood affiliates in the state, Planned Parenthood of Metropolitan New Jersey and Planned Parenthood of Northern, Central, and Southern New Jersey, which collectively operate 22 health centers and provide healthcare, education, and services to tens of thousands of patients every year. For today's testimony, we would like to focus on our appreciation for New Jersey's historic investments in high-quality family planning and reproductive health, including the Department of Health's direct family planning grants to providers, as well as the forgivable loans for facility upgrades available through the New Jersey Healthcare Facilities Financing Administration. We encourage this continued funding by the administration in FY 2026. Ensuring equitable access to healthcare is a key value of Planned Parenthood Action Fund of New Jersey that we share with the Murphy administration and the Department of Health. For years, New Jersey has taken bold steps to protect and expand access to reproductive health care. In his first act in office in 2017, Governor Murphy signed legislation to restore much-needed family planning funding that had been stripped from the state budget by his predecessor for 8 years. More recently, Governor Murphy signed the Freedom of Reproductive Choice Act, protecting the right to abortion in New Jersey in the face of threats to our rights by the U.S. Supreme Court. And in the FY 2024 budget, the legislature passed historic investments in family planning funding, funding for Medicaid, and funding to support abortion providers across the state via these facilities, security, and training grants. Since Roe v. Wade was overturned in June of 2022, Planned Parenthood health centers in New Jersey have continued to do everything in their power to increase access to abortion. Now, 2.5 years post-Roe, as of November 2024, 21 states and counting have banned or severely limited abortion, creating a patchwork of abortion access throughout the country. New Jersey abortion providers, including Planned Parenthood health centers, are helping to provide access by seeing more patients who are seeking abortion care in New Jersey because of these bans and restrictions in their home states. Furthermore, the facilities grants has allowed both affiliates to make significant upgrades and renovations to many of the Planned Parenthood health centers in the state. Some examples include being able to invest in size-inclusive exam tables and equipment, adding and modernizing elevators so that patients have access to our health centers and can receive inclusive care, and the recent opening of a health center in Absecon, New Jersey. Planned Parenthood Action Fund of New Jersey is incredibly grateful for all of the historic investments in reproductive health care and family planning under this administration. However, it's important to note that healthcare costs continue to increase annually. Costs increased 4.1% in 2022, the most recent year for which data is available. So it is more expensive for providers to serve the same amount of patients, let alone see any additional patients. In addition, Americans are also struggling with the cost of healthcare, meaning that providers continue to see patients who cannot afford to pay for their care, including those with insurance, putting more pressure on family planning grant funds to make up the difference. We look forward to continuing to partner with the Department of Health in FY 2026 to ensure the health of all individuals and families in New Jersey. Thank you again for all you do to advance the health of all New Jerseyans.
Thank you for your testimony. We'll now invite Kathleen Noonan to provide hers.
Hi, can you see me on camera?
Yes, we can. Thank you.
Okay, good. I can't see myself for some reason, but that's okay. All right, well, I think it's officially afternoon, so good afternoon, everyone. Thank you so much, Commissioner Baston and members of the Department of Health leadership and staff. Thanks for scheduling this listening session and providing us with the opportunity to provide input on the FY26 budget. My name is Kathleen Noonan, and I'm the president and CEO of the Camden Coalition, a multidisciplinary nonprofit working to improve care for people with complex health and social needs in Camden, New Jersey, South Jersey more broadly, and really around the country. As one of New Jersey's 4 regional health hubs, the Camden Coalition also functions as a strategic planning partner to state agencies, whether that's through program design, conducting community needs assessments, or designing population and patient level interventions. I want to thank you, the Department of Health, for continuing to invest in programs and initiatives to strengthen our statewide health information network, expand the number of harm reduction centers, reduce maternal and infant mortality rates, and fund federally qualified health centers. And this is just among so many other things. While the federal COVID-19 public health emergency is now behind us, we really appreciate the investments that DOH is making and trying to make in both state and local public health programming and infrastructure. We've been very pleased to work with the Department of Health from the beginning on the Colette Community Health Worker Institute and the CHW Hub that's now at Ascenda, and most recently in the incubation and launch of a statewide public health institute. Additionally, we are requesting the department's continued investment of $2.5 million in the Camden Coalition's Pledge to Connect program, which we actually started incubating when the QUIP program was just being developed around the behavioral health metrics. So the Pledge to Connect program is a program that involves 4 health systems and 2 certified community behavioral health centers in the South Jersey region. We have staff from the certified community behavioral health centers embedded in the emergency departments. And the idea is that for people who are not in crisis, they're not going to be sent to a crisis center or not admitted, that they have a warm connection to behavioral health care. All of our hospitals that have been involved in this program have actually received QUIP benefits. They've done really well in the QUIP program. So we are really pleased with that and believe that this program has also really brought together the certified community behavioral health centers and the hospital emergency departments. One of the things, though, that we realized is that we have to bring our identification more upstream. And so this year we are launching something called regional triage, where we are identifying people who show up in multiple emergency departments across our region for behavioral health care. And we are sitting as a group with all of the health systems and the certified community behavioral health providers to figure out who's in the lead. One of the problems here is that there's no regional mechanism for people who are really shopping across these different health systems and shopping for lots of reasons, because they are homeless, because they are looking for care that they feel like they're not getting, or because this is just the only thing they know to do. So what we're hoping is with the continued investment that was made last year in the governor's budget and by the legislature, that we can actually bring this program more statewide, that we can work with other health systems with the help of the Department of Health, and that we can really launch what is an innovative program right now in South Jersey and for New Jersey, but launch it around the state. So thank you so much for letting me testify today and for having this listening session.
Thank you for your testimony. I'll now invite Cherie Pace to provide testimony. Cherie Pace, would you like to provide testimony? All right, we will move on to Anita Madhavan. Anita Madhavan, would you like to provide your testimony? All right, we will move on to the last of our registered speakers, Missy Lee. Missy Lee, would you like to provide your testimony? All right. If you have not registered to speak, but you do wish to provide testimony, hold on one moment. If you have not registered to speak and you would like to provide your testimony, or you have joined after we have called your name, please raise your hand or make a note in the chat and we will call on you to provide testimony. Hold on one moment. All right, I see we have Rachel Baum's hand raised. Rachel. Rachel, would you like to provide testimony? All right, Rachel, we will come back to you if you're still interested. Margarita Leahy.
Hi, good morning. Thank you to the Department of Health staff for providing this opportunity to testify on the health needs of our community. My name is Margarita Leahy, and I am the Executive Director of Mercer Council. Mercer Council has been committed to providing high-quality substance use and behavioral health prevention and early intervention programs, services, and support to our community for over 45 years. We work with our community members to implement evidence-based tools and education that empowers them to make healthy, safe, and responsible choices that maintain their health and good quality of life. In this last year, Mercer Council has reached 5,330 plus students with an emphasis on middle school and high school students. We are requesting that the Department of Health consider funding the following prevention education program and public health campaign for the Mercer County community. The first one is that there has not been a large focus or funding allocated to evidence-based prevention education at the lower elementary school levels from our usual funding sources of DMOS and DCF. Research shows that helping early elementary school students with increasing their emotional intelligence and emotional regulation can decrease future bullying behavior, substance misuse, and mitigating adverse childhood experiences. We respectfully request funding for using an evidence-based program to focus on prevention programming for early elementary grades at a cost of $200,000 to $300,000 to reach at least 1,000 early elementary school students. Our second ask is, since the legalization of cannabis, Mercer Council's Prevention Coalition educators have recognized the following needs for funding to help keep our community members safe, using public safety campaigns on billboards regarding cannabis use so that community members can make informed decisions. Our coalition can create the campaign messaging using information from our New Jersey Prevention Network that has done extensive research. The public safety campaign would have a cost of $50,000 to $70,000 for the year. These are all costs based on past initiatives that we have rolled out in the community. I also have other parts of my testimony that are not direct funding requests, but are still things we believe that should be advocated for funding. Mercer Council was partially funded for a mini prevention program for older adults that provided wellness, healthy aging, and safe practices for medication management. That mini grant has expired, and we were told that there is no more funding available on the horizon. There's an increase in the older adult population, making this initiative more important than ever. Please include a budget line item to fund these types of underfunded prevention initiatives for older adults. I'm also echoing an ask about the public health offices. We work in tandem with many public health offices. Many township public health offices are short-staffed and find it difficult to provide enforcement of the regulations, especially for zoning laws that protect our youth. If DOH can assist townships with funding so that they can maintain and enforce strict zoning locations that keep dispensaries and other types of smoke or edible shop locations far enough away from school zones. We believe that by funding the township public health officers, they should be able to address these issues as well as continue to address the flavored tobacco enforcement in the local community. We would also like for funding and research to help create diagnosis technology for cannabis intoxication. This will help to provide law enforcement for keeping us safe on the roads and provide guidance for drivers. Last but not least, we would like to have some continued funding for the opioid crisis by continuing to fund things like the opioid overdose recovery program, the STAR program, and other programs that are helping with addressing the opioid crisis. We thank you so much for your time and consideration to our requests and providing this opportunity to directly request and advocate for the prevention and safety needs of our New Jersey community. Thank you so much.
Thank you for your testimony. We'll call on Alex Akins.
Hey, folks. Just make sure. There we go. Good afternoon. Thank you, Commissioner and committee members, for having me today. My name is Alex Akins. I'm the Director of Programs at High Tops, a nonprofit organization dedicated to promoting the health and well-being of young people with a focus on LGBTQ+ youth throughout New Jersey. I'm honored to provide this testimony on behalf of High Tops as we seek inclusion in the upcoming budget for the Department of Health. LGBTQ+ youth in New Jersey, like their peers across the country, are facing a mental health crisis that demands urgent attention and resources. According to the Centers for Disease Control and Prevention, nearly 75% of LGBTQ+ students report persistent feelings of sadness or hopelessness, and almost half have seriously considered attempting suicide. These statistics are even more alarming for transgender youth who face higher rates of discrimination, rejection, and isolation. In fact, they are 2.5 times more likely to experience depression, suicidal ideation, and to attempt suicide than their LGBTQ+ peers. New Jersey is home to over 50,000 LGBTQ+ youth between the ages of 18 and 24, many of whom encounter systemic barriers to mental health care, such as stigma, lack of family support, and a dearth of affirming providers. The most recent community health assessment conducted by the Greater Mercer Public Health Partnership shows a pronounced disparity in mental health needs and access to services for LGBTQ+ youth compared to their heterosexual and cisgender peers, data that is echoed throughout the state of New Jersey. Without increased access to affirming youth-centered mental health services, these young people will remain at high risk of anxiety, depression, and suicidal ideation, as well as the overwhelming public health crises of sexual violence and abuse, homelessness, self-harm, and drug use. High Tops is uniquely positioned to fill the gaps in access to safe, affirming mental health care for New Jersey's LGBTQ+ youth. Serving over 3,500 people annually, our programs provide not only the mental health and social support services crucial for the healthy development of young people, but also the leadership and advocacy training essential to empowering the next generation of LGBTQ+ leaders. Information, support, and education that enables parents, educators, and community members and other adults to support and care for LGBTQ+ youth, and the resources and tools for institutions and systems to create and maintain supportive, affirming environments. A comprehensive list of our programming is available in my submitted written testimony, but in the interest of time. I'll skip over it for right now. Last year, the New Jersey Department of Health's budget reflected expanded support for underserved populations. However, dedicated mental health support for LGBTQ+ youth was insufficient, especially in contrast to the well-documented and escalating needs of the community. Inclusion of high tops in the FY 2026 appropriations budget would send a clear message across the state that the DOH is committed to increasing access to mental health support and services for queer youth and their families, and to ensuring all our young people residing in New Jersey receive the care they need. Thank you for your time and consideration. We look forward to the opportunity to partner with the Department of Health in our shared mission to promote the health and well-being of all young people in New Jersey. Thank you, everyone.
Thank you for your testimony. We will call again on Rachel Baum.
Thank you so much. Can you hear me now?
And thank you.
Great. Sorry about that. My Zoom crashed as you were calling on me earlier, of course. Good afternoon. My name is Rachel Baum, and I am the president and CEO of the New Jersey Family Planning League. Thank you so much for your previous support and for this opportunity to share our recent accomplishments, future goals, and ongoing needs as we strive to work hand in hand with the New Jersey Department of Health to continue to expand access to essential reproductive health services across the state of New Jersey. The NJFPL appreciates our partnership with the Murphy administration, and we look forward to continuing to collaborate with the NJDOH to ensure this funding directly supports services delivered to those who need it most. The New Jersey Family Planning League is dedicated to providing high-quality, accessible, and equitable sexual and reproductive health services. We support a network of 20 healthcare providers across the entire state, serving over 123,000 family planning patients and nearly 24,000 abortion patients annually. Our network includes 63 family planning healthcare service locations and 24 abortion care sites. We aim to guarantee that every individual, regardless of identity, income, need, or insurance status, has access to these crucial services. I'd like to share some of NJFPL's key project and recent achievements. The Expanding Abortion Access Program. This program, developed in close collaboration with the NJDOH, addresses critical needs through a network of 6 providers, including Planned Parenthood affiliates and independent clinics. We offer patient support, extended in-office hours, and are adding telehealth services. We also provide community outreach to educate the public about options. Our family planning project, through a network of 17 family planning providers, we offer comprehensive care, including sexually transmitted infection, cancer screenings, complete contraceptive services, and comprehensive reproductive health education. Our focus on and underserved communities ensures that all patients, including those from low-income and classically marginalized backgrounds, have access to affordable, high-quality, and respectful services across the state. Our efforts in maternal health have expanded to include enhanced provider training and education open to all providers, not only those funded through our service grants. In FY 2025, we are offering new training sessions on contraceptive care and advanced family planning procedures to further empower providers across the state, including hands-on training for clinicians on insertion and removal of intrauterine contraceptives, sometimes known as IUDs or IUCs, and contraceptive implants. Sometimes these contraceptive types are referred to as long-acting reversible contraceptives, or LARCs. We're offering family planning health worker certification training and other essential courses for healthcare providers. To continue providing essential services and reach our goal of equitable, accessible, high-quality, patient-centered reproductive healthcare across New Jersey, we need to focus on several major funding priorities. One is geographic coverage and expansion of services to meet modern needs and emerging challenges. It is critical to ensure that trusted reproductive health services continue to be there for individuals and communities across New Jersey, regardless of changes nationally. This includes expanding capacity and geographic coverage so healthcare providers are able to keep up with patient need and demand for time-sensitive services, even as reduced access in other states may drive people to seek care in New Jersey. New Jersey is a model for reproductive health care access, and these services must continue to be available and accessible to our residents and to every person seeking them. The New Jersey Family Planning League uses ongoing needs assessment data and leverages the knowledge gained from our report done in partnership with Rutgers School of Public Health called Abortion Needs and Availability in New Jersey. There's a link in our written testimony submission to identify areas of high need. NJFPL is pursuing partnerships with providers in southern New Jersey and other areas of the state where there are limited abortion and reproductive health care providers. This means expanding our funded provider network, including telemed options, mobile units, and partnerships with community-based services to address geographic, transportation, and privacy barriers. We also are working to expand the scope of practice for certified registered nurse anesthetists. Along with the overall healthcare workforce challenges everyone is encountering, we encounter a shortage of anesthesia providers. We continue to advocate for the expanded role of certified registered nurse anesthetists, CRNAs, in providing proper sedation under physician supervision. This change would provide a more affordable alternative to anesthesiologist presence and enable more trauma-informed and accessible abortion care, especially for complex surgical procedures. In conclusion, the New Jersey Family Planning League is steadfast in our commitment to advancing health equity, enhancing the quality of care, and expanding access to essential reproductive health services. We look forward to continued collaboration and partnership with the New Jersey Department of Health to ensure these services remain affordable and accessible to all New Jerseyans. Thank you for your time, consideration, and support.
Thank you for your testimony. At this time, there are no additional individuals who have indicated they want to provide testimony. So I will hand it over to Commissioner of Health for closing remarks.
Thank you, everyone, for joining today, for taking time to listen in to the public budget testimony, and for those who took the time to prepare and share your testimonies with us today. We thank you for your interest in public health and your dedication to the work that we all do together. And thank you again for taking the time and telling us what is most important to you. Hope you have a great afternoon.